Hi, my name is Grace Perron, and I am doing a teaching project on preventing the spread of germs for the senior project of Nursing 480 Senior Practicum. The spread of germs in the classroom. Young children may lack fundamental understanding of germ transmission. Assessing the level of knowledge and readiness to learn while engaging with educational tools that promote learning can have a positive impact on the spread of germs. Starting from the preschool period, nurses play an important role in school health services by helping children develop positive health habits and encouraging them to take a more active role while acquiring these habits. Why this project? Successful completion of proper hand hygiene and the education of germ transmission in elementary age children can have a positive outcome depending on effectiveness of teaching and measurement of post-education knowledge. Preventing the spread of germs is incredibly important to reduce the spread of illness and/or disease. This presentation was created to educate children at Anderson Creek Academy on germs and proper hand hygiene in an effort to reduce the spread of germs in and outside of the classroom setting. Components of an ideal educational program. Determining the level of current knowledge and understanding of hand hygiene practice. Education and engagement provided at a level of understanding geared towards the audience, in this case, elementary age students. Engagement with teachers and other staff members to promote proper hand hygiene. Identifying learning styles. In order to successfully educate elementary age children, it's important to identify and understand the learning style before attempting to educate students. Understanding the attention span, readiness to engage in learning in activities such as singing and dancing, and readiness to participate in group activities such as games or group discussions. After completing the learning styles appropriate for the audience, educational tools and materials should be incorporated to promote effective teaching. One study concluded that children needed a visible proof of germs, and that association of casual attitude regarding illness could possibly be a barrier to practicing regular hand washing. Also mentioning communication of public health information despite readily access to cell phones and television, the community ecosystem was the most trusted source of information and influence. Teaching techniques to match learning styles identified. Visual, poster board with pictures. Tactile, interactive germ simulation. Auditory, education in classroom setting. Verbal, group interaction. Cognitive evaluation, pre and post testing. Ultimate goal, to increase the knowledge surrounding proper hand hygiene and preventing the spread of germs in the classroom setting. For all students that attend this educational experience to achieve an 85% or greater on the post testing, demonstrating an understanding of the educational materials provided. Learning experience. Children learners engage in learning when they have visual educational materials such as poster boards with pictures, visual interactive simulations such as germ glow, and group participation with a visual demonstration on how to wash our hands while singing a song that children can sing to that demonstrate the length of time we should be spending washing our hands. Educated children can teach others on proper hand hygiene and promote hand hygiene behaviors to reduce the spread of illness in and out of the classroom. This is a picture of me with my children at the school and with a picture of the poster board that I used for educational purposes with pictures. This is the glow germ product that I used with a black light. I sprinkled some onto my children's hands before going into the presentation, and when I had them enter the classroom, they went around giving high fives to the students in the classroom, and after my introduction, I went around with the black light to look at the children's hands to demonstrate how the spread of germs can happen, and you can't even see that it's there. I conducted a classroom presentation with my children and the poster board. I went over what germs are, how they are spread, and how to prevent the spread of them by incorporating proper hand hygiene. As part of the classroom engagement, I visually demonstrated how to properly wash your hands. Then I had all the students practice with me while singing the ABCs so they would know the length of time they needed to spend washing their hands. Evaluation of teaching project. This teaching project included 3 presentations in the classroom setting with a total of 48 students, ranging from grades kindergarten to 5th grade, with a total of 26 girls and 22 boys. The pretest showed a 75% comprehension of the presentation material. Post-presentation survey showed a 95% comprehension, demonstrating an understanding of the presentation material. I was not able to take pictures of the students at the school due to privacy. However, the children engaged in the learning process and asked many questions and gave positive feedback surrounding the presentation. The staff members also provided excellent feedback and would like to incorporate the germ glow into the classroom in the future to demonstrate how germs are spread and reduce the transmission of illness. Personal evaluation. I was able to successfully meet my personal goals for the senior project by conducting a presentation on proper hand hygiene in order to prevent the spread of germs. I was able to use teaching methods that best suited the selected demographic. By conducting this presentation, I believe the students will participate in proper hand hygiene in the classroom setting and at home. This presentation demonstrated that education can effectively impact knowledge surrounding hand hygiene on students in the classroom. Education on this topic can have a positive impact on reducing the spread of germs and preventing further infections. By completing this senior project, I practiced the roles of a lifelong learner, member of a profession, educator, and information manager. As nurses, it's important to have a dedication to learning and teaching, so we have the ability to provide education not only to our patients in the hospital, but also to our community members in order to reduce the spread of infection and disease.